Hello everyone, I'm Dr. Sandre and I'm an infectious disease specialist here at Health Sciences North in Sudbury, Ontario, Canada. In this short video podcast, I would like to review the current information around COVID-19 vaccination in Canada and more specifically in Ontario. I realize that some of this will become out of date as more information becomes available. I would like to compare the current vaccines currently available in terms of their effectiveness, their safety, and more specifically, how effective they are against the variants of concern and the issues around blood clots. As of April the 20th, 2021, there are 4 vaccines available in Canada. The rollout of these vaccines, I would refer you to your local public health institutions. There are 2 messenger RNA vaccines and 2 viral vector vaccines available. Pfizer and Moderna are messenger RNA vaccines, and the AstraZeneca and Johnson & Johnson are the adenovirus vector vaccines. And the premise and goal of all of these vaccines is to basically trigger your body into making antibodies and develop an immune response against SARS-CoV-2 virus, which causes COVID-19. Antibodies are made against the spike proteins on the surface of the virus. The messenger RNA vaccines are a relatively new technology carrying the genetic material for the spike proteins in a lipid or microscopic fat sphere, whereas the viral vector vaccines carry the genetic material in a completely deactivated adenovirus, which cannot replicate or cause any disease of itself. Adenovirus vector vaccines are also in development to prevent other infectious diseases such as hepatitis C, tuberculosis, Ebola, and influenza, as well as in cancer management. How do these 4 vaccines compare? First of all, one cannot compare the vaccines head-to-head because they were not developed that way. They were all developed at slightly different periods of time and in different populations, and the variants may or may not have been present during the clinical trials. That being said, all the vaccines are 2 doses except the J&J vaccine, which was developed as a single-dose vaccine. All the vaccines are highly effective in preventing COVID-19, up to 95% effective with the messenger RNA vaccines. Even in vaccinated people who develop COVID-19 infection, the vaccines were 87% effective in preventing severe COVID and therefore preventing ICU and hospital admissions. There is also increasing evidence that those who have been vaccinated and develop COVID-19 infection but with no symptoms will also be less likely to transmit virus to others. The effectiveness of these 4 vaccines against the original COVID-19 strain is really remarkable in these studies. The current 2 hot topics around the vaccines are, number 1, how effective are the vaccines against the variants? And number 2, the issue of blood clots. I will address these one by one. First of all, how effective are these vaccines against the variants of concern? COVID-19 variants are mutants. With the massive explosion of the pandemic, the virus replicates with mutations, thousands of them. Most of these are inconsequential and lead to nothing. But some mutations are important and cause the virus to become more transmissible and more lethal. The 3 big current variants of concern, or VOCs, are the B117, or UK variant, the B1351, or the South African variant, and the P1, or Brazilian variant. In Ontario, currently as of this month, 2021, the 3rd wave is driven almost entirely by the UK variant. So for us in Ontario, the current question is, how effective are the 4 vaccines against the UK variant? This is a complicated question. The answer currently comes from laboratory information and real-life data in countries using the vaccines and have the variants. Future clinical trials will add more information. For now, it appears the antibodies made in people vaccinated with the Pfizer messenger RNA vaccine is able to neutralize the variant viruses in the laboratory, particularly the UK and Brazilian variants, and less so with the South African variant. Real-life data collection has shown so far that all these vaccines are over 74% effective against the UK variant and less so for the others. The second issue revolves around blood clots. Now, do not confuse the blood clots which occur with COVID-19 infection and those that occur with vaccination. These are two completely separate and unrelated issues. Without going into too much detail, there is a risk of blood clots with COVID-19 infection, which is not minor or inconsequential. In fact, the risk is about 16%. But there is also a small risk of different blood clots with the AstraZeneca and the J&J vaccines themselves. Scientists are working on the reasons why, but it appears to be due to a rare antibody produced against what is called platelet factor 4 and found in 22 patients with blood clots with the AstraZeneca vaccine. This study was just published in the New England Journal of Medicine, April the 16th, 2021. That being said, these patients developed low platelet counts, which is a component of your blood involved in clotting, and patients developed mostly cerebral venous thrombosis, a very specific type of blood clot in the veins of the brain. This occurs almost always in women under the age of 55 and within 4 to 20 days after vaccination. It is treatable with blood thinners. The incidence is 1 in 125,000 to 4 to 6 per million people vaccinated, which is approximately 0.0004%. Though it's a risk, it is small. And to put it in perspective, there is a risk of blood clots in women on the birth control pill of 0.12%, and those that smoke with a risk of 0.18%. The risk of blood clots with smoking is estimated at approximately 300 times the risk of blood clots with AstraZeneca or J&J vaccine. So in summary, you as an individual need to decide on the risks of COVID-19 infection versus the risks and benefits of vaccination. The consequences of infection I may elaborate on in a future video podcast. I hope this helps to add some perspective to this topic. Thank you for listening.